medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
In our last installment, we basically talked about heart failure in general. Today, the diagnosis. The history and physical always will play the prime position for determining any type of disease where the diagnosis will be supportive. Chest x-ray, for example, may clearly show fluid levels as well as a CAT scan of the heart. MRI, which is entered the picture soon as well, also can give you some answer. Myocardial biopsy, which I talked about when we talked about inflammation of the heart. And of course, the sine qua non is the echocardiogram, especially looking at the ejection fraction, which should be normal. But today, I want to discuss with you the ability to diagnose this by getting the correct blood test. Now, the initial tests that you should look at are B-type natriuretic peptide level. Some laboratories call it a amino-terminal pro-B type natriuretic peptide. I call it NT-proBNP. It's easier. Both of the tests show similar information, although the absolute values of the NT-proBNP are about 5 to 10 times higher than BNP. Levels over 100 may be a sign of heart failure, and by the time it gets to 400, it's clear that it is. But it varies, these tests, from sex, body mass, health history, and other factors. And there are other things and other conditions that can lend itself to abnormal NT-proBNP. That's kidney failure, dialysis, lung disease that's severe, pneumonia, COPD, coronary artery disease, and even atrial fib. But in addition to your workup, to the proBNP, which should hold a central component to this workup, there are other tests that could be reviewed. For example, you should look at calcium and magnesium because diuretics cause dysrhythmia. A blood count because anemias can cause this. Liver failure because hepatic congestion or volume overload can end up in heart failure. Renal function because there are causes of that. Electrolyte levels because they become imbalanced. Even TSH, thyroid stimulating hormone, because either hypo or hyperthyroidism can cause heart failure. And of course, look at the urinalysis simple test and other tests that for alternate reasons you can always look for inflammation through the SED rate, the C-reactive protein high sensitivity as well. And of course, Lyme serology if you believe there's a Lyme etiology. And also get iron levels like ferritin, transferritin, etc. Also, perhaps take a look at the thiamine B1 level, because beriberi and alcoholism and these deficiencies can also lead to problems with having heart failure. And there are other tests that you should be doing for comorbid conditions for risk management purposes, lipid levels, and of course hemoglobin A1C, because diabetics often can get heart failure. Now, this was a lot to fit in a small segment, but if you review it a couple times and make sure that your lab tests are up to par with proBNP being at the center of it, you'll understand that high levels of this will make a very good suggestion that you should go further and look at the heart, perhaps with getting cardiology evaluation right away for echocardiogram, etc. On the next installment, I'm going to talk about natural things that you and I can do to be able to reduce heart failure problems. And by the way, we're going to be working at the cellular level as opposed to just giving if-then type of medication. So I'm sure you'll enjoy hearing that. For Access Laboratories, I'm Dr. Mitch Ghen. More information, go to drmitchghen.com. Thanks for watching.